Welcome back to the Morning Show here on the Rise News. I am Adeola Duduyemi.
And I'm Rufai Hussaini.
In 1968, world leaders proclaimed that individuals had a basic human right to determine freely and responsibly the number and timing of their children. About 40 years later, contraception remains out of reach for millions of women, men, and young people.
World Population Day was instituted in 1989 as the outgrowth of the Day of 5 billion, marked on July 11, 1987. Since then, every 11th of July in the world is World Population Day. This year's celebration does not have a specific theme from the United Nations. Rather, emphasis globally is on the unmet goals of the 1994 International Conference on Population and Development, which happened 25 years back in Cairo, where 179 governments have adopted that reproductive health and gender equality are essential for achieving sustainable development.
That's right. Well, to shed more light on this year's adopted theme is Adeola Duduyemi, a medical doctor with experience in clinical medicine and public health. She currently works for Johns Hopkins University Center for Communication Programs and Nigerian Urban Reproductive Health Initiative, NUHI.
Well, before we get started, let's take a look at this report.
Nigeria is one of the most densely populated countries in Africa, with approximately 200 million people in an area of 920,000 square kilometers. It is also the country with the largest population in Africa and the seventh largest population in the world. Approximately 50% of Nigerians are urban dwellers, with a rate of urbanization being estimated at 4.3%. Nigeria is home to over 250 ethnic groups with over 500 languages, and the variety of customs and traditions among them give the country great cultural diversity. The three largest ethnic groups are the Hausa, which is 27.4%, Fulani 6.3% of the population, along with the Yoruba 13.9% and Igbo 14.1%. The Efik, Ibibio, Anang, and Ijaw constitute other southern populations, with Urhobo, Isoko, Edo, and Shekiri constitute Nigeria's Midwest. Most of the population is a young population, with 42.54% under the ages of 0 to 14. There's also a high dependency ratio of the country at 88.2% per 100 non-dependents. Three of the main religious groups are Muslims, Christians, and other indigenous beliefs. Nigeria's population has been increasing rapidly for at least the last 5 decades due to high birth rates, quadrupling its population during this time. Growth was fasted in the 1980s after child mortality had dropped rapidly and had slowed down since then. The birth rate has also declined slightly. According to the 2017 revision of the population prospectus, the population was 185 million, and in 2016 compared to 37.86 million in 1950. The population of children under the age of 15 in Nigeria was 44% and 53% between 15 and 65 years of age. The Nigerian government has said that it wants to curb this rapid population group, and it has offered free contraception over the past 10 years. And they're also thinking of steps to discourage people who are looking to have large families.
It's Dr. Duduyemi joins us now in the studio. Good morning. Thank you for coming on the show.
Good morning. Thank you for having me here.
All right, real quick to it, Dr. Duduyemi. Nigeria's population said to be over 200 million now, 201 million.
Yes.
Is it a blessing or a curse? Let's start from there first before we start to dial back. Is it a blessing? If it's a blessing, you say yes. If it's a curse, say yes. So, and let's see the side of divide you are.
Definitely, it is a blessing, but we have a part to play in ensuring that we harness the dividends of our demographic. Right now, we are not doing that very well, because we could say that we have more of a demographic disaster than the demographic dividends that we're supposed to have. Currently, we have what we call a youth bulge, meaning that we have a large population of young people. And the ideal is that young people are more vibrant, they should be working, they should be contributing to the economy of the country. But I'm sure if I ask you, waking up in your house this morning, coming out, I'm sure you saw a lot of young people who are idle. And that's because some basic things are not in place. We are talking about education being made available. We are talking about infrastructure, both social, amenities, health. So all these things need to be in place for us to be able to get the advantages of demographic structure, which is our population.
It's well over 10 years since Nigeria conducted the last census. And so even the 201 million estimated population,
Yes.
we are relying on international bodies who have done that estimation. On a day like this, World Population Day, what should the focus of Nigeria be? Policymakers, government, because we do not even know how many we are.
Well, for me, I believe that what we have is, it's with us. We have our population. So we need to put in place policies that will ensure that all these things I've earlier mentioned, which are like wheels. When you have wheels oiling each other, moving together, and, we talk about education, we talk about economy, we talk about family planning, which is very key in ensuring that all these things, work together. So our leaders need to wake up to the responsibility of ensuring that policies are in place for everyone to be able to harness, the dividends, the advantages of our population.
I mean, I remember very vividly when we had the census in the early 90s, 92 or 93, if I'm not mistaken, and the population there was about 88.6 million.
Yes.
And since then, we had started talking about reducing the population. And as at 88.6 million then, there's a lot of complaints that this is quite too much.
Okay.
And I remember under the administration of Ibrahim Babangida then, it was said that, we should start making steps at reducing the population. But it looks as though we've had policies, but those policies are just somersaulting.
Yes. A lot needs to be done in terms of implementation, because it's not just about having the policies, we have the documents, everything is in place. But if people are not driving the implementations of this policy, then definitely we will still remain where we are. And as an organization, what we focus more on is managing the population. Because what we say, we talk about family planning, meaning that you are able to make informed choices about when you want to have children, how you want to have them, especially as a woman, because you know that it has a lot to do with your health. So when a woman is able to make that decision that, okay, I want to have children now because, okay, I'm ready for it, I need to go to school, so I'm putting a pause on it. So we need to create more awareness, more information for women to be able to make informed choices about, the number of children they have and when they have them. So all this we need to keep increasing this awareness. Definitely, family planning is not about saying, okay, don't have children, or don't have what you want to, what you can afford. We are saying have the number of children that you can cater for. For instance, if I have 3 or you have 4, and I know that I have the capacity to take care of them, then we'll not be talking about young people roaming around the streets and not able to, give us, are not able to contribute well to the economy of the nation. So much emphasis needs to be laid on people having children that they can cater for by choice and not by chance. Because a lot of people have, like statistics tell us that every minute in Nigeria, in the last few minutes I've been here now, every minute 14 children are born. And overall, UN tells us that in a year we have about 7 million additions in terms of children being born. And we still have high infant mortality rates, meaning that number of under 5 children dying per 1,000. I think the statistics is really very, it gets to me. When you say 1 out of 10 children are dying in Nigeria, you still have women dying as a result of pregnancy. Pregnancy is not a disease if well properly managed. If we have infrastructure, we have health facilities that are in place.
Exactly, and that brings me to the debate. The last minister, Professor Isaac Adewale, announced at some point that we're supposed to bring there were plans to bring the contraceptive prevalence from 15.1% in 2017 to 36% by last year. I don't think that happened. I don't know if you have a contrary statistics to that. To improve the quality of women and child, that's the debate.
Yes.
But some will argue that the quality of life of a woman does not depend on family planning and usage of contraception. Rather, the accessibility to quality health and affordable health. That's the debate. But for you, what is the underlying issue?
Okay, thank you. Well, everything goes together. If you say a woman should have quality health, part of health is her reproductive rights. Being able to make a choice about children. I go out a lot and I see women saying, oh, I've committed 3 abortions, 4 abortions. And they're like, well, they even think it's their own way of controlling their, their births because they don't have, that awareness and that information that they can do this. Like you were talking about the statistics. We said we were going to reach 36% by 2018, and we came back and said, oh, we can't achieve this. So we said, okay, 27% by 2020, which is already staring us in the face. And if things still continue the way they have, because I doubt if we've had so much improvement in terms of infrastructure. Well, thankfully, Lagos State is doing a great job. But when we talk about Lagos State, you are talking about like close to the ideal for Nigeria. If you go to the northern states, you see the infrastructures they have. So if you say a woman's right to health, which includes maternal and child health and family planning, reproductive health is all inclusive. So if we are talking about that, that means that we really need to go dig deeper and see what factors are responsible for this. A woman is pregnant, she goes to the facility. There's no doctor, there's no nurse. There's nobody to attend to her. She's bleeding. There's no blood available. So all these are factors that we need to, look at and ensure that we invest more. We are talking about health in Nigeria. How much do we put into health budget? And, it's not even about saying we are allocated. The issues we have is there's allocation, but there's no release.
Okay. Speaking of health budget, recently a stat was released, and we're going to be going through a quick breakdown. You get to answer this. Okay. The stat was released on...
Well, we have to go on that break now.
We have to go on that break now. All right.
We'll be right back to discuss some more. Stay tuned.
All right, welcome back to the morning show here on Arise News. And we're still talking to Adeola Duduyemi, all right, and it's World Population Day today. Before we went on that break, I was asking a question. I was talking about, you talked about healthcare. Only recently a stat was released that said an average Nigerian gets about 1,500 naira on healthcare by the government every year. Another part of the conversation I want to look at that we've not looked at in all of this is, and while you were talking about having this raging debate about contraception, is the role of the TBAs, the traditional birth attendants, because they are more prevalent in the market. Most people in the lower tier of society, it's easier for them to go to a TBA to even ask for a contraception method than to come to a conventional doctor. I mean, how have you been able to harmonize? Because if you want to increase this level of contraception, the TBAs have to work hand in hand with you.
Yeah.
So have you been able to harmonize the TBAs in this fight?
Okay. Well, thankfully, Lagos State has a TMB, that's the Traditional Medicine Board. It's supposed to regulate the traditional birth attendants. But only recently, I think yesterday on the news, I was hearing that they were going on a rampage, trying to find out people that were not registered. And we found out that quite a number of them are not registered. But for us as an organization, and I know that a lot of other organizations are working with TBAs, we recognize their impact because we know that people believe in, the people around them, people that live in their community. And what we've done so far is, we've trained quite a number of them on...
How many have you trained?
About 200 in Lagos State. We've trained about 200.
And they're well over 200,000 in Lagos State?
No, not up to 200,000. About 3,000 plus. They are
3,
registered.
Registered.
There are more
but
of them.
Unregistered are well over...
Well...
Hundreds of thousands, 200,000. So I know what I'm saying.
There are a lot of them, but we reckon with the registered ones because they are the ones that we know that the government is regulating. Yeah. So what we did is train them on interpersonal skills like counseling and also referrals. We know they can't give more than the condoms because pills, injectables, and other methods are supposed to be regulated in terms of you need to counsel the clients properly. You need to carry out investigations to be sure that this person is not hypertensive, this person has controlled hypertension, which we know that may not really be in their capacity. And we've gotten quite a number of good results. People refer. In fact, sometimes these TBAs even follow their clients to the facility, take them there themselves to ensure that they take up these methods. So it's a good cause, but there's still a lot more to be done because, like you said, a lot more of them are unregistered. That means that we can't really curb the kind of things they are doing, the kind of practices and the kind of services that they are giving to people.
Acceptance by the TBA is another one. Because there are lots and lots of, religious outlook to this. That's another very fundamental factor. Lots of religion some adherents of some religion will say, it is my natural God-given right to be able to have as much as I want to have.
Yes.
That it's, in fact, they'll say it's a curse to me if I don't have all the children God has given me in my stomach.
Yes, but what we keep saying is information. people change when they hear correct information. You know, our values, when we talk about our values, these are things that we've believed over time and we have seen our forefathers pass to us. But by the time people get information, we've had that experience. You know, some of them initially, they were resistant, they were not really interested. But by the time, you know, you give them correct and adequate information about these things and, you know, they begin to see the results, they look at it and they say, oh, this is true, this is really working. And by so doing, they are changing. So some people, their values have changed. Well, we can't deny the fact that some people will still remain on the other side. But a lot of people are really moving.
Let's talk about, because you mentioned some factors earlier and you referred to the North.
Yeah.
Are you saying that there's a disparity in what happens in the South and in the North? Because family planning has been a long-running debate and a cold war between pro-life advocates and the government in Nigeria.
Yes.
We also know that family planning is a basic human right. Rufai already mentioned, a lot of people feel it's my God-given right. In fact, it is a fundamental human right recognized by the United Nations. How do you then encourage, first you tell us the situation in the North, as you highlighted earlier, but how do you encourage them to give up this basic human rights, given the harsh economic realities we are faced now?
Thank you for that. We all know that things vary in Nigeria when we talk about north, south, east, and west. And sometimes it's also as a result of exposure. For instance, even when you talk about maternal mortality ratio, in Nigeria it's about 576 per 100,000 live births. But when you come down to Lagos, you have 555. When you go up north, it's over 1,000. But really, a lot has been done. For instance, my organization will work in Kaduna, and we've seen a lot of improvement in terms of acceptability. And one key thing is advocacy. Advocacy to key stakeholders, ensuring that they speak up on family planning. When you hear your imam or your pastor or your government, your governor talking about family planning, you tend to begin to reason more. Oh, if this person that I believe so much in is talking about it, then that means there's a truth about it. So when we talk about, you know, the North and the South, definitely there's a variation. But currently now, a lot is being done, and people are really, you know, taking up family planning. You know, but there are also variations in the way you talk about it. In the North, for instance, you talk about childbirth spacing. In the South here, we talk about family planning. So they see, okay, I'm spacing my child. Because it's not saying don't have children. It's saying, okay, you can have children, but have a spacing between for your own health, for you to recuperate as a woman, for you to be able to go back to your business, and also to be able to contribute to the economy of your own, you know, family. So a lot is ongoing, and advocacy is really key, ensuring that there is, you know, more political will. So now we have commissioners, governors talking about family planning. We have the Islamic perspective to family planning. We have the Christian perspective to family planning. So things are really changing, but it's just that we need to move a bit faster.
Right. This comes to the corporate sector, because while we talk about this, we forget that there's some very draconian laws in the corporate sector that also, you know, stifle these expressions. Take, for instance, you have been told that when you get a certain job in a certain institution, I'll say the banks, you can have a child in the first 2-3 years. And it has led to people, when they now finally like to have a child, they go a little bit overboard and say, okay, let me have all my children in the space of 3, 4, 5 years, because the bank will not allow me to go ahead and do that. I mean, what has been the engagement with the corporate sector?
Well, I won't say much about that, but I know that, like you said, family planning is a human right, and everybody needs to know this. So, and when we talk about family planning, it's not just about not having a child now. It's also about having a child now, because even fertility issues are involved with family planning. So as a corporate organization, you are infringing on a woman's right if you say, oh, you can't have a child now just because you have a job. I believe that conversations are ongoing, though I'm not so private to that, but I believe that conversation is ongoing to ensure that, you know, things change around this.
Let me even take you on the contraceptive method. Okay. We've heard cases of people that complained about cancer when they use intrauterine devices, IUD and things like that.
Side effects.
The side effects, a very dastardly side effect. You know, we've had people, I mean, I know the jury's not out on this yet, but we've had people that have constant complaints, and they've even gone ahead, you know, to make these complaints known in the public space. That, okay, this method. Well, you know, we've even heard some conventions that this family planning method has just come reduce the population of Africa so that the West will have dominance over us. We've had conversations like this. I mean, what would you say to this?
Well, I'm sure, first of all, talking about dominance, we already have dominance if it's population, because we are saying that by 2050, Nigeria is going to have a population of over 400 million if we are still going at this rate, meaning that one out of every 43 people will be a Nigerian. So that's not about dominance. And coming to talk about the issues around undesired effects, it's more of myths and misconceptions. It's more of rumors, because people here says, we do that a lot in Nigeria. By the time they tell you a story, you had to it. It goes to the next person, you had to it. And at the end of the day, you don't even know that that was a story you told me initially, because things have really changed. So there are a lot of myths and misconceptions. But, we are scientific people. We base our judgments on what World Health Organization has done. A lot of research is ongoing and have been going on about family planning, and there's none that is tied to, cancer and all the rest. Fine, we may have some undesired effects. For instance, somebody has a method and maybe has some bleeding side effects. And the thing is, all these side effects or undesired effects can be managed. And one thing about family planning or contraceptive methods is that there's no one method suits all. It's just like when you're talking about paracetamol. Some people take paracetamol and they react to it. There's no drug that doesn't have an undesired effect. But the way an individual reacts to something differs from the way the other individual reacts to it. And if I take this and it's not fine with me, just like my doctor can say, oh, take this drug. If you have such certain effects, please, we have to switch to the other one. And that's exactly how family planning methods are. If I take a method and it's not okay by me, in terms of maybe the undesired effects I'm having, then I can always switch to another method. But talking about cancer and all the rest, there's no proof to that. In fact, some family planning methods are known to prevent some cancers, because they have certain...
Like what are these methods?
Like we have the hormonals, for instance, the estrogen hormone, the progesterone hormone. Having it, because another thing people need to know is that these are hormones that are already in the female. Any hormone in any hormonal contraceptive is already in your system. So it's not a string thing coming in. It's just that, okay, you have it in a certain quantity to regulate or prevent ovulation so that pregnancy does not happen. And that is what also happens when a woman is pregnant. Some certain hormones come down, another one increases. And when the woman delivers, another hormone increases, another one it reduces. So these are normal, natural things in the woman that happens regularly. For instance, I have been on family planning for over 6 years or thereabout, and I've not had any issues of such. Some have issues, they are managed and they are fine. So there's nothing that says that family planning causes cancer or causes any disease at all.
Interesting debates when it comes to family planning in Nigeria. Some would argue that, because it is not 100% efficacious, you still have the high rate of unwanted pregnancies, because when you use the family planning and there is an unwanted child, then it leads to unwanted abortion. But let's talk about moving forward. Is this a case of the chicken and the egg, which comes first, population or development? And government policies over the years in increasing contraceptive usage in the country has not worked. We have never really met that target, like you've said initially. Do you think we can adopt the old China child policy?
Well, I believe that what we have been doing so far is working.
Is it?
It's just that it is not working as fast as we would like it to work. And that is because a lot of things still need to be put in place. For instance, as an organization, we've been working in Lagos for over 4 years. And when we came in, we did like a performance improvement assessment to see, okay, what exactly is on ground, a needs assessment. Fine. When you talk about family planning, we are still driving towards making it a social norm, in the sense that we want people to be able to talk about it and be able to freely, go in for the services. And we looked at the facilities. Okay, we have a family planning room. Fine. Is it in a place where somebody feels comfortable? Is there privacy? When we're talking about privacy, we're talking about auditory and visual privacy. So we went ahead and, did what we call the 72-hour clinic makeover, in which we ensure that there's a private room for family planning, there's a place for counseling, and there's a place for insertion. So this, in fact, we have results showing that as a result of some of these interventions, there have been a very, increase, a large increase in terms of contraceptive uptake. So I believe that there's still a lot that we need to do. And we are talking about Lagos State. When we are talking about the Center of Excellence.
Lagos,
So,
Lagos seems to be the example
We'll be
here.
right back after this break. We'll take a quick break. We'll be right back.
Great to have you back. You're still watching the morning show here on the Rise News, The Last Lap, and we have Dr. Duduyemi still with us, a medical doctor, and we're talking about the World Population Day. So we had talked about policies and the way forward and why it's so slow. You are saying population is a blessing if we have the infrastructure to take care of the people. But some would say, are we not heading towards a population stability instead of an explosion? I mean, in our old age, would we have young people taking care of us if we're saying we should slow down population growth now?
Well, if you say, okay, I won't have the number of children I can cater for, meaning that means that child you are giving birth to is not likely to have education. It's not like, and that means at the end of the day, what you intend to achieve, you won't achieve it. Because you want to say you want to have children that will take care of you when you're old, and you have had children that you couldn't even send to school, and they are even depending on you when you're old. So that forfeits the whole thing that you're talking about in the first place. So we can't really go in that direction.
Okay, let me play devil's advocate and press this argument further. 1960, Nigeria, 35 million population on independence. Italy, 35 million population at Nigeria's independence. Many years down the line, we're over 200 million. Italy, 60 million. Japan had been growing so much, it gets into a stage now, close to about 30% of the population in Japan are over 65. Now, Japan is encouraging its citizens to please have children. In fact, there are government grants and subventions to encourage people to have children. In Italy, it is the same. They're shouting the workforce is shrinking. But we, in this country, 0 to 40, we have about 44.5%. Yes. So we have a viable workforce, young people that can come into the workspace. I mean, are we not just shouting at miss? Okay, I was giving the instance about Canada. But you came out to say at this one that Trudeau didn't say, okay, people can come into Canada. But let's look at the stats. Canada has close to over 9 million square kilometers of land. And they've got 37.5 million population. So obviously, they need more people. Yeah. We have 200 million people with 923,000 square kilometers of land. So are we not just... some people will say we are okay. All we just need to do is to empower that young population, teach them science, technology, engineering, and maths, get them equipped for the fourth industrial revolution and the tenets of what the new future and the new reality will be, and we're good. That even these so-called countries we're saying we want to be like, Japan, for instance, now they're looking for a workforce to fill up because the over 65s are no longer in the workforce. Well, I mean, what do you say to that argument?
Well, I think you have kind of answered the question you posed to me because you are saying you have tried to compare the populations and you have already proposed a solution. We have a viable, like I said earlier on, we have a youth bulge. The only issue we have is that our youth bulge are not empowered to be able to contribute to the economy. Rather, they are sapping on what we have currently because we have much more much more dependence in Nigeria than independence. People are depending on, so we have a small workforce and we have a large number of dependent people pulling down and dragging on that little resource that we have. So you kind of answered the question. You said putting in place infrastructure, which is what I said earlier, socio-economic policies, implementation of those policies. We are talking about budgets.
What are these policies? Okay,
policies about health. And we've talked about universal basic education, which is exactly what was said in ICPD. Remember that population day, our team for today is saying ICPD 25 years ago, accelerating progress. So we made promises, universal basic education. Where are we with that in Nigeria? Even in the streets of Lagos, you see children roaming around, not having education. We've talked about reducing infant mortality, reducing child mortality ratio. Where are we with that? We are still saying that 1 in 10 children die in Nigeria. 1 in 5 on the 1 are dying. That's infant mortality. We are talking about maternal mortality ratio. Where are we with that? A woman is pregnant and dies as a result of pregnancy, complications of pregnancy. Why? Pregnancy is not a disease. So where are we with that? We've talked about sexual and reproductive health available for the young ones. And in our organization, we talk about life planning for adolescents and youths, which is not just about saying, okay, have family planning. We are saying give information that will help people make right choices, that will ensure that, they have the best of life. So looking at all these 4 things I just mentioned, where are we with them in Nigeria?
And talking about the ICPD in Cairo, 1994, it bordered around women's rights and health rights and children's rights. But 25 years after, would you truly say that women lack the rights to make decisions about their own body? Because that's what Cairo 1994 was about. Yes. Would you say women still lack the rights to make those decisions?
I would say that. Maybe for the few that are educated, or even some that are educated still don't have the rights to do that because, we say, you have to wait for so person before you make a decision. A woman is saying, and that's what we see in the facilities every day. A woman is saying, I don't want to have a child yet now because I'm in school or because I want to ensure that my business is okay. But her husband is saying, no, you can't have family planning. I've heard so much about it. But they are not even coming to it. So we are talking about male involvement. Ensuring that even the males know why a woman has to have this contraceptive method for her own health. Because I'm sure no man really wants his wife to die. But they don't just have that adequate information to be able to make, that choice. And, it's in Nigeria, we still run a sort of, a woman depends on my husband. I have to wait for him to, yes, we have to wait for him to make decisions. So I'm sure, we are still far from it.
So should we not be having these conversations with the men instead of the women? It seems like there's so much emphasis on the women contraception. Are there no contraceptions for men?
Well, there are a few for men.
Why is the conversation around the woman and not the man?
Because more of the methods are for the women. And besides, who gets pregnant? If a man says, I'm not using any of this method, who gets pregnant at the end of the day? Who goes through labor? Who has, when we are talking about maternal mortality rate, who are we talking about? So this is the reality facing us. And we always talk about male involvement, advocacy to the men. Let the men, in fact, we've seen situations now that men are the ones bringing their wives to the clinic. And we have situations where the woman takes up a method that she knows her husband will not know about. Because this woman has had 5 children. Her husband is not working. So she's barely surviving. She's barely surviving. And now she knows that it's my right. So she's making a decision for her own self.
But the shocking part is, just after ICPD in 94, we had Beijing Women's Conference in 1995. Yes. And we rehatched these issues. But why is it that we never reached, a viable resolution after Beijing Conference, after ICPD in 94? It still keeps becoming a revolving decimal.
Well, I believe it's the same reason why we are still here in Nigeria. Considering the resources that we have, management of those resources, policies being, not even just policies being on ground, papers, everything, but now having the political will to ensure that these policies are actually implemented, having people that have passion to ensure that things really move forward. It's not just us talking about. We can talk from now till God knows, but we need to act, and this is the time to act. We need more advocates. We need more people who are really, interested in ensuring that we have better quality of lives. A lot of us travel out of the country, and we see what is happening around us. So can we implement some of these things in our own country to ensure that we have better life for people?
What would you say is the priority? Because we've had situations where these women go to the clinics, I think you mentioned that earlier, and these contraceptives are not even available. Nobody's talking to them about it. What would you say the priority should be on a day like this that we're talking about population-related issues? Should it be the advocacy, the implementation of policies or new policies, or even making the contraceptive available? What should be the priority?
Well, the priority for me...
And they're expensive too.
Exactly.
They're very expensive.
They are.
For
really.
people in the lower rung of society.
They are, but for Lagos State, for instance, makes it free. In any primary health care center you go to, you have it free. But we still have some issues around, consumables. Somebody can turn back for as little as 200 naira. Okay, so we don't have cotton wool, or we don't have iodine, we don't have plaster, we don't have gloves. How do we get that? Fine, there's a lot of effort going into ensuring that this happens, but we are still a long way to it. So we talk about ensuring that we already have policies. Okay. It's just ensuring that these policies are implemented. Increased advocacy, ensuring that even from the local governments, funds are released because PHCs are really for the local government. Funds are released from the local government, and we have seen a lot of improvement in this, but I still know that we still have a long way to go. So the contraceptives, the federal government is ensuring that they are available, but we have some issues now around, funds. UNFPA is the one doing most of ensuring that there's commodities, but in the last few months, we've had issues, especially with implants being available because a lot of issues with funds, and, the government needs to really wake up to this so that we don't go back to, now everybody has to pay for it. So
even condoms are expensive in a country where people live on less than $1 per day.
But in Nigeria, really, it's free. You can walk up anywhere in any facility.
Any government facility?
Any government facility. Condoms are free. Contraceptives are free.
Okay.
In Nigeria.
I hope that by this time, July 11 next year, we will not be back to talk about the same issues. It's kind of redundant when you do that. Hopefully make a way forward. Thank you so much, Dr. Duduyemi, for coming on the show today.
Thank you, too, for having me.
And that's been our show. I'm Adeola Duduyemi.
And I'm Rufai Hussaini.
Thank you for watching.